Good morning, good afternoon, good evening, and good night, depending from where you're watching and listening to me around the globe. I am Mbono Ugonna Silas. By vocation, I am a Catholic priest. By profession, I am a licensed clinical psychologist. In my YouTube therapeutic videos on conquering bad habits, today I want to talk about handling substance abuse or dealing with drug addiction. So what is a substance? It is a chemical element or compound that can be organic or inorganically manufactured. In the medical parlance, drug can be used in a beneficial way for therapy or for therapeutic uses. But we are talking about drug addiction, overuse of drug, and abuse of substances. So when we talk about addiction or abuse, we are talking about something being compulsive, obsessive, and impulsive in its usage. So it is a kind of inordinate use or ways to use this medication or this drug or these substances that will be harmful to the health of the individual. So when we talk about addiction, it is a state of psychological or physical dependence on the use of drugs or other substances such as alcohol. But when we talk about substance abuse, we are talking about a pattern of compulsive substance use or marked by recurrent, significant social and occupational or legal or even interpersonal adverse consequences, with 9 associated drug classes such as alcohol, amphetamines, cannabis, cocaine, hallucinogens, inhalers, opioids, sedative, hypnotic, and also anxiolytic medications or drugs, and in the local parlance, or colos or mmiri. Then often this time drug abuse or substance abuse, they are interchangeably used. But however, I want to give a slight difference. Substance abuse is a broad term that refers to the use of any substance, illegal drugs, prescription drugs, over-counter drugs, or alcohol in excessive amount. But drug abuse refers to the use of drugs only, not alcohol, illegal drugs or prescription drugs, over-the-counter drugs in excessive amount. So what are the causes of these? Wrong lifestyle, unhealthy environment, wrong exposures and company, poor parental upbringing. They have spoiled children. The parents allow them to do whatever they wanted, and they are spoiled in their behavior, in their morality. They have poor family history, peer group pressures, unhealthy curiosity, negative adventurism, experimentation, and other unknown causes. Now, what are the effects? There are many. Inability to fall asleep or stay asleep, sleeping or waking up at odd hours, losing interest in things that you used to enjoy earlier, difficulty concentrating, unusual laziness, you stop taking care of yourself, avoiding meetings with friends and other social interactions, spending more time alone than usual, unusual decrease or increase in appetite, decreased performance at work, having problem with family, frequent and sudden shifts in mood swings that you undergo, and strong urge for you to continue to abuse medications. Then, is there any therapy for drug abuse or drug addiction or substance abuse? The answer is yes. If you cooperate with the therapies, you'll be set free. It's very unfortunate people don't know what drug does to our youngsters, to many people who are under drug. You will not know all these things until you get into the field. This drug will go and trigger a neurotransmitter in your brain to release dopamine, which is called the I feel good hormone. You say, I feel hard. Somebody said, I smoke the good stuff, and you feel good, you feel hard, but you're killing yourself. So the therapy, or the best therapy, is you can combine preventive therapy and curative therapy. Prevention is better than cure. Avoid occasions that lead you to drug addiction. Avoid people, places where you go. Avoid friends who are drug addicts. Then combining therapy with medication. There are some psychotherapeutic methods also you can use, like cognitive behavioral therapy, dialectical behavioral therapy, mindfulness, family, personal, group therapies. And you can send the person to rehabs, a good rehab where people can go and come out healed. But due to frequent relapses, it is very, very difficult for drug addicts or substance abusers to overcome it. But it's not impossible. Once you cooperate with your therapist, I believe you'll be okay. Decide, desire, determine that you'll be okay. I hope you enjoyed this video. You are free to share, to comment, to like, and also to subscribe. In my next video, I'll be talking about a topic that you will like. How to conquer gambling disorder or gambling addiction. There are many people who are gamblers, and it has destroyed their lives. Thanks for watching this video. God loves you, and so do I. Bye.